Okay, you can start. You can start.
All right. Good morning, class. Welcome to today's discussion. We are going to look at disorders of the urinary system. Next. So a bit introduction of the urinary system. I think the urinary system consists of the kidneys, the ureters, urinary bladder, and the urethra. The kidneys form the urine and account for other functional activities of the urinary system. The ureters carry the urine away from the kidneys to the urinary bladder, which is a temporary reservoir for the urine. We're just trying to remind ourselves how the urinary system operates. Next. The urethra is a tubular structure that carries the urine from the urinary bladder to the outside world. Just like I said, we're just trying to remind ourselves what consists of the urinary system. So in this introduction, we are just trying to remind ourselves that the urinary system is made up of the ureters, the bladder, as well as the urethra. Next. So now let us start what we have to learn today. There are a lot of disorders which are associated with the urinary system. Among them is renal tumors. So in today's discussion, one of the disorders that we're going to look at are the renal tumors. So let us start. The renal tumors can be benign or malignant. The renal tumors can be benign or malignant. So these tumors, we are calling them renal tumors because they are invading the renal system. They are invading the renal system. So these tumors, we are saying they can be benign or malignant. By benign, we mean they're just localized. They're not invading other structures. When we say malignant, we mean they are cancerous. They can spread to other organs. So benign adenomas or non-cancerous tumors are small and usually discovered unintentionally during other investigations. So these benign adenomas of the renal system, they are non-cancerous, or they cannot spread to other organs. And in most cases, these adenomas or these non-cancerous tumors, they are normally discovered when we are trying to investigate other problems which are associated with the renal system, depending on what problem has brought the patient to the hospital. So we discover them unintentionally, not that we knew that someone is having benign tumors of the renal system. Then hemangiomas are rare but may cause drastic hematuria. Hemangiomas are rarely but may cause dramatic hematuria. So we're saying these hemangiomas, which are also tumors of the renal system, they are rarely found, but once they've been found with a patient, they may cause hematuria, which is blood in urine, and it is seen in most cases with patients presenting with various disorders of the renal system. Next. Kuntemba, are we together?
She's muted.
Oh, okay, I see. The malignant new growths, new growths are the nephroblastomas, in bracket, Wilms tumors. Malignant new growths are the nephroblastomas, in bracket, Wilms tumors, which are seen in infants, and the hypernephroma, carcinoma of the kidney of adults. So the cancerous tumors, or remember, in the beginning we said it can either be benign or malignant. We discussed earlier on benign, and this time we're looking at malignant. We're saying the malignants, which are new growths, they can be nephroblastomas or can be called Wilms tumors, and which are seen in infants. Which are seen in infants, we mean children. And the hypernephrema or carcinomas of the kidney, which are seen in adults. So when you see hypernephromas, these are carcinomas or malignant tumors which are found in adults. Then when you talk of nephroblastomas, these are malignant tumors or growths which are found in infants, Then both tumors are primary malignant tumors. So both the nephroblastomas as well as the hypernephroma are both primary malignant tumors. They just start. So metastasis from other tumor sites may occasionally be found in the kidney. So these tumors which we are discussing, the malignant tumors, which can either be in children or in adults, their origin can be from other sites, various sites where a person may have malignant tumors. Remember, metastasis simply means the spreading of tumor cells to other regions. So a patient may have malignant cells in the brain. They may have malignant cells of the breast. They may have malignant cells of the lungs, and these tumor cells may spread to the kidneys through the lymph or through the blood. And once they go to the blood, depending on the age of the person, they may present themselves like we've discussed, saying hypernephrema or nephroblastoma. If those tumors are in children, then they present as Wilms tumors, while when they are affecting adults, they will present as hypernephroma tumors. Next. Now let us look at the nephroblastoma, which are malignant tumors of children in renal system. So these tumors usually occur in children under 4 years of age. So these, we have to be very careful in screening our children. If these children, they have tumors of the renal system, we find that their age will go with those having 4 years and below. They account for about 10% of all childhood malignancies. So if you look at tumors affecting children of under the age of 4 years, nephroblastomas accounts for about 10% of all malignancies. So they are quite common. They grow very rapid, and there is early local spread, including invasion of the renal vein. So this is quite bad in children because their growth is quite rapid, and once they start growing, they involve the renal vein from the kidneys. Like we said, like we discussed earlier on, we saw that the renal vein is quite is very important in as far as anatomy and physiology of the kidney is concerned, because it also contributes in the removal of carbon dioxide through various metabolic reactions that are taking place in the kidneys. So when the renal vein has been damaged, it simply means that the ability to get rid of various nitrogenous weights in terms of carbon dioxide gets inhibited. The removal of nitrogenous weights through the renal vein becomes reduced. Hence, the kidneys are being predisposed to damage. The distal metastasis most common appear in the lungs, liver, and the bones. So when someone has renal tumors of the kidneys under the nephroblastomas, when these tumors start to spread, they like spreading themselves to the lungs, the liver, and the bones. So when someone is 4 years old, or below 4 years, when they normally start complaining of the liver, or they are presenting with a right abdominal pain on the right quadrant, don't just think of acute abdomen, but you should also think of nephroblastomas, because the tumor might have come from the renal system and spread to the liver. Also, problems to do with the upper respiratory tract infections. You also need to investigate the renal system for nephroblastomas, because we have been told that they can spread to the lungs, liver, and the bones. Next. Next. So what are the signs and symptoms that we expect to find in a patient who has nephroblastoma? For saying the cardinal sign is a large abdominal mass, which is first noted when the baby is birthing. So there we go, mothers. It's not just birthing of our babies, but we also need to observe some of abnormalities that we see as we are birthing our babies. Like we said, the metastasis may go to the liver, the lungs, as well as the bones. So when you are birthing a baby, you may see that the baby is not presenting with the abdomen that is normal, because there is what we call hepatomegaly, which is the enlargement of the liver. So you need to know the normal abdomen of your child. So the abdomen may be big because of the liver that has enlarged. Then sometimes fever and hypertension may also be present. The child may present with hypertension and fever, and in most cases, this fever is because of the infection which is there, and hypertension is because of the damage that has been caused to the renal system, where we say the renal system functions to regulate and maintain the fluids in the body. So when the fluids in the body are not well regulated, it simply means that there will be overwhelming fluids in the circulation. As a result, the heart will be taxed to be pumping a lot of fluids, which could have been regulated by the kidneys, which are well working. Next. So what are some of the investigations that we can do in nephroblastomas? One of the investigations that we can do is intravenous urogram, which is abbreviated as IVU, intravenous urogram, where you pass the urogram into the ureters so that you can do this investigation. here you have the chance of visualizing the kidneys. You have the chance of visualizing the kidneys, and you tend to see what is abnormal with the kidneys. Then you can also do the chest X-ray to detect the metastasis. You can also do the chest X-ray to detect the metastasis. As we said, once metastasis has taken place, there is high possibility that you can see the tumor cells in the lungs, the tumor cells in the liver, as well as the bones. So you can do any of the X-rays of the organs which have been mentioned, and you have to look at the normal appearance of these organs on various films. It being ultrasound scan or X-rays, you need to pay attention to the normals. Where you find metastasis, you find that there will be dark capitation of these structures. There will be dark capitation of these structures. The structures will never look clear on the X-rays. Next. So treatment of nephroblastomas is what we call transabdominal nephrectomy. Transabdominal nephrectomy, this is where you remove the kidneys abdomen. Through the So I'm saying this is where you remove the kidney abdominally. So the kidney has to be removed through the abdomen. Then there's also what we call radiotherapy. You can treat nephroblastomas through radiotherapy, that is using rays, by use of ultraviolet rays. Apart from radiotherapy, you can also treat this by use of chemotherapy, using a combination of actinomycin D and vincristine. So generally, this is just a repetition, because we know that when a condition is being caused by cancerous cells, the treatment involves chemotherapy, surgery, as well as radiotherapy. So where we talked of transabdominal nephrectomy, that simply means surgery. And where we talked of radiotherapy, we're talking of radiology. And where we talked of chemotherapy using combination of actinomycin D and vincristine, that simply means a combination of chemotherapy. So generally, we've learned already, say, conditions which involves the cancers. They are treated either by surgery, radiology, or radiotherapy, as well as the chemotherapy. And in most cases, treatment involves the combination of two of these various treatments. Next. Next. Okay, so that is how we attend when we are treating a patient who has come with hypernephromas, which are tumors affecting children of less than 4 years of age. Now, let us look at the hypernephroma or renal carcinomas, which are tumors affecting adults. They are tumors affecting adults. So this is the commonest malignant tumor of the kidney. This is the commonest malignant tumor of the kidney. The incidence in male is 3 times greater than in women, and most patients are over age of 40. So in hypernephrema, we are saying it is quite common in males. And you know the reasons why males should be prone to renal tumors. It is because of the activities that men find themselves. Like, for example, if we talk of alcohol drinking, the percentages of alcohol drinking between male and females, you will see that there is a bigger percentage of male drinking as compared to females. And alcohol damages the kidneys because alcohol is a chemical, and once the chemical is taken in large quantities, damages the kidneys because the kidneys themselves acts as excretory organs. So when you take the chemical in large quantities, you abuse the organ that excretes the chemicals, which happens to be the kidneys. Hence, you find that the male the male rate may be quite high as compared to the ratio of female counterparts. So the tumor spreads in the renal pelvis, causing hematuria. So once the hypernephrom happens in male counterparts or in the kidneys, this tumor spreads in the renal calyces, hence causing hematuria of blood, which is seen in urine. Next. What are the signs and symptoms that we expect to find in patients who have hyperinephremia or tumor of the kidneys? So we have pain. They may present with pain, hematuria, which is blood in urine. Then a mass may be palpable. So when we talk of pain, this pain is a special pain, or it's not just any pain that a patient may just think of, or a medical personnel may just think of. We're talking of pain that will be felt at the back of the abdomen, or in the lower abdomen, specifically the region where we find the kidneys. Like I said, or if we are to go back to our anatomy and physiology, to find that the kidneys are located on the 12th thoracic vertebrae, as well as on the 3rd lumbar vertebrae. So around this region, that's why we expect the pain to be more severe. Then hematuria, this is just blood that will be found in urine. Then a mass may be palpable. A mass may be palpable because the kidney will be affected. This kidney may start getting bigger. As a result, when you try to palpate, this mass may be felt on palpation. Then a remarkable range of systemic effects may occur. This may include fever, raised ESR, that is erythrocyte segmented rate may be raised. Then polystemia, as well as disorder of coagulation. We're talking of there may be delay in clotting levels when someone injures themselves, because all this is principally done by the renal system, which happens to be the kidneys. Next. Then abnormalities of plasma proteins and the liver function tests. Remember earlier on we said when someone has tumors affecting the renal system, some of the organs which also gets involved includes the liver. And once the liver gets involved, it may not perform correctly its functions, and therefore there will be abnormalities of plasma proteins and liver functioning tests. There will also be pyrexia of unknown origin, which is abbreviated as PUO. Someone will be having high temperature, but the exact cause of this high temperature will be unknown. Therefore, it will be very important that you also take a mile further by examining urine, which can give some parameters that someone is having some renal tumors, which we are discussing today, the hypernephremas. Then
Someone raising,
neuropathy
Mr.
is
Piri.
also there,
Mr. Piri.
reduced sensation in the
Mr. Piri.
peripherals. Yes,
Someone is raising
yes,
hand. They wanted to ask question.
I can hear you.
Some,
Yes,
someone wants to ask question. They are raising hand.
yes, yes.
I don't know that one.
Let them ask.
Yeah, you can ask.
Who is that one?
I forgot her name.
Is it Vincent?
Yeah, Vincent. Vincent.
Vincent, ask the question.
I want to ask that question at polycythemia.
Yes.
Like what really it is. I haven't like heard about it before.
Polycythemia simply means increased secretion. Increased secretion, and there will be increased the urine output.
Oh,
Yes. Yes.
all right. Thank you.
So the systemic effects
You can continue, sir.
yes, the systemic effects may also be due to secretion of the tumor products such as renin, erythropoietin, parathormone, as well as the gonadotrophin. So these hormones, they help in the regulations of these hormones. They help in the regulation of these hormones, especially the urinary system. So when we talk of the urinary system, some of the hormones that we can't go without mentioning, it is the erythropoietin, which helps in the production of red blood cells, then the gonadotrophins, which plays a very important role in sexual reproduction. Next. So investigations that can be done as well includes needle aspiration. So needle aspiration is you just connect the needle to the syringe and you aspirate. The aspirant should be sent to the laboratory for analysis. So in the analysis from the laboratory, they will give a detailed report as to whether the tumor is benign or malignant. And that's not the only method that can be used to confirm whether the tumor is malignant or benign. You can also do tissue bulbs, lunar bulbs through the cystoscope. You can also do ultrasonography to detect whether the mass is solid or cystic. And this is done at the radiology department. Also, computer tomography can be done. Remember, you need to know the normal size of the kidney. You need to know the normal size of the kidney. If not mistaken, the normal size of the kidney should be about 3 centimeters wide, 12 centimeters long. So when you visualize this on the CT scan, you need to know whether the kidney is getting bigger. If the kidney is getting bigger, it could be a sign of an infection, and you need to find out what is the source of this infection. It could be malignant tumors or just other urinary tract infections. Then you can also do what we call arteriography. Arteriography, this is where you set a tube through the renal artery or the renal vein so that you can also visualize or appreciate microscopically what is happening with the kidney. So you visualize this, or you do this with the help of the machine, not using your naked eyes. You can also do chest X-ray. You can also do a chest X-ray where you'll be interested to know whether the kidney is normal or whether the kidney is bigger. If there are tumors which are quite bigger, you can also detect them on the X-ray, because they are going to show that there is another image that is going to show. Then isotope bone scan to detect metastasis. Earlier on, we discussed that metastasis can involve the liver, the bone, as well as the lungs. So on these images that you are going to see on various X-rays that you may take, you'll be interested to see if those X-ray or images of various organs that you've captured, they are normal. Skeletal X-ray to detect as well metastasis, which I've already mentioned. So where metastasis is present, like we said, metastasis normally involves the liver, the bone, and the lungs. You need to exclude any abnormal structure that is going to appear on the lungs, on the liver, or on the bone, as this could mean that there is a metastasis that is taking place from the hypernephrema, which are the tumors of the renal system affecting the adults. Next. Again, we go to the treatment. So treatment of hyponephremas, which are the tumors affecting the adults, it is the same. You have to go with surgery, which is radical nephrectomy. That is the removal of the kidney, then as well radiotherapy. The treatment which involves the use of high radioactive rays. Then there is no effective chemotherapy for these tumors. There is no effective chemotherapy for these tumors. Chemotherapy is there, but there is no effective. Hence, a combination of these can always be helpful. Next. So that was the first disorder, and the second disorder of the urinary system is trauma to the kidneys. Trauma to the kidneys. So now let us look at the disorder of the trauma to the kidney. So injuries to the kidneys may occur as a result of a fall, a kick, or a road accident. Injuries to the kidney may be as a result of falling from a tree, or being kicked, or as a result of a road traffic accident that you may involve yourself. So the injury may be anything from a bruise to a severe rupture or damage to the renal vessel. So once you injure yourself, this injury can be different. It could be a bruise, it could be something severe, or something severe that it can even go as far as damaging the renal vessels. When we talk of the renal vessels, it could be an artery or it could be a vein. If the peritoneum is in front, if the peritoneum is in front of the organ, if the peritoneum in front of the organ is torn, peritonitis may occur. Injuries may be open or closed. So we are saying when the injury that is affecting the peritoneum, when it happens, it has been torn, then peritonitis may occur. Then these injuries to the kidneys may either be open or closed. These injuries may be open or closed. Next. Let us look at open injuries to the kidneys. So open injuries such as gunshot or stabbed wounds. Open injuries can be as a result of gunshot or stabbed wounds. Then open lacerations of the parenchyma collecting system or pedicle are usually associated with other injuries within the abdomen. So under these open injuries, we're just being told, say, how can this be possible? It can be caused by gunshots or stabbed wounds. Stabbed wounds, especially those who like fighting using sharp instruments, knives, screwdrivers, all those can be an example. Then lacerations, which can affect the parenchyma, which is the tissue of the kidney, it can happen within the abdomen. Next. Then under closed injuries, these are of two types. We have what we call direct blunt injury. This may be caused by a fall against the edge of the bathtub or a blow or a kick in the lawn. In the lawn, we simply mean the area closer to the kidneys, especially on the back of the abdomen. In the back of the abdomen. So when you get kicked, you may have a blunt direct injury on the kidneys. You have a blunt direct injury on the kidney. These injuries are commonly associated with fractured limbs, and if on the right side, with injury to the liver. So we're saying these closed injuries, in most cases, you find that they have been caused or they've been associated with the ribs. Like we say that these ribs are also very adjacent to the kidneys themselves. Next. Apart from that, we also have what we call major renal trauma, because we had the direct blunt trauma, and this time we're talking of the major renal trauma. This may occur as a result of rapid deceleration. For example, in air collapse or road accident, the pedicle is injured rather than the kidney. The deceleration injuries to the pedicle may cause intramucosal spasm or thrombosis of the vessels. So when we talk of the major renal trauma, we're talking of the trauma that is affecting the pedicle. The pedicle is one of the major tissues of the kidney. So when this happens, or when the major tissue of the kidney has been injured, we are like to see that we are like to see thrombosis of the vessels. When we talk of the thrombosis of the vessels, we're talking of the major vessels supplying the kidney. That is the renal artery, the afferent artery. When we talk of the afferent artery, we're talking of the effects being so severe, affecting the glomerular